COVID concerns continue across the state as we see this rise in cases and a major rise in demand for testing. Joining us now is the Department of Public Health Commissioner, Dr. Manisha Juthani. Thank you so much for joining us for the news at 5:30 right now.
Thanks for having me.
Okay, so let's talk about our positivity rate, because it is skyrocketed, 21.5% today, according to your department. As I recall, I think that's the highest since May of 2020. And we have some 1,400 patients that are hospitalized with COVID complications. I remember early on, 1,200 was what we were seeing at its height. So we're in the thick of it right now. What is the level of concern within your office, as well as from state officials at this point?
So I think we do know, based on those hospitalization numbers that you just quoted, that we have surpassed our peak last winter. We are not at the point yet where we were in the beginning of 2020. But what I'm most concerned about is the fact that 70 to 80% of people who are in the hospital are unvaccinated. And this burden is significant in terms of the patients that we have to take care of in the hospitals. So vaccination is still our number one way to keep people out of the hospital.
How is our hospital capacity? I think you were in Stamford this morning, or at least state officials were talking to the hospital there. What does it look like across the state? Are our emergency rooms, our intensive care units being overrun? Are they concerned at this point?
So our hospitals are certainly running at very high capacity, somewhere between 87, 90% in that range. And we are in regular discussions with all of our hospitals. As you said, I was at Stamford Hospital this morning. They were reporting that they are doing well where they are right now. But I do hear reports from physicians across the state in terms of the level and acuity of patients that are in the hospital right now. So we are in discussions on a regular basis of how to be able to care for both COVID patients, but all the other patients that have been sick with so many other conditions and really need medical care as well.
There's certainly a lot on our healthcare workers' plates once again. Okay, we got to talk about these lines that we're seeing across the state. Our Tony Terzi was on the shoreline today with these 2 hour plus long lines. Like, people are trying to do the right thing. They want to get tested. Why has it been so hard to ramp up testing capacity in our state? We know around Thanksgiving, when we weren't as concerned, or we didn't even know about the Omicron variant at that point, that we saw people flood for the holidays and go and get testing. There are critics that are saying that the state was flat-footed on planning for a surge. Of course, it's easy to Monday morning quarterback, but why is it so hard to ramp up our capacity?
So there are several things I think we have to remember. As you mentioned, a month ago, most of our testing sites that we have run by the state, at that point, it was 23. We had plenty of capacity. And what we've seen with the Omicron variant, which has doubled in every 2 days, essentially, is that we are having so many more cases than we were before. I think there are several things that I want people to know. First of all, if you have symptoms, the chances that what you have is COVID is high. It is reasonable to go get a test, but if you're young and healthy and you're recovering pretty quickly, if you don't get a test right away, that is okay, in the sense that you can continue to try to find a self-test or something else to be able to continue to recover and stay at home. If you work with somebody else to be able to help get you that test where you don't need to go out and potentially expose others, that is another good way to operate. Doing testing just because you're concerned you could have been, exposed at some place is less important right now. We want to make sure people are getting tested for the right reasons, which is that you have symptoms or you had a significant exposure to somebody. And so at this point, I've had people ask me, I had symptoms 7, 8, 9 days ago, but I tested negative on a self-test. Should I go get a PCR test? The reality is you really don't need to if you are better. There's no need for that if you don't have travel restrictions, you're going somewhere where you absolutely need a PCR test. So let's optimize the testing that we do have. As you mentioned, we are continuing to stand up new sites. This particular variant is doubling at such fast rate that the sites that we had up that had nobody there, all of a sudden now have a million people there. And I do understand that. So we are continuing to work at this to get at the testing issue in our state.
I'm being told to wrap, but I have a quick question here, because you're talking about how it is the Omicron variant in the state. I didn't get to see the list that the department, you all sent out, that we get to see a breakdown of COVID data here in our state for the day. But I know on Thursday, you all were breaking down the Omicron versus the Delta variant, and there were only like 200 Omicron cases versus 15,000 Delta cases. So are we seeing Omicron? Are those numbers a little bit off at this point?
Yes, there's no question that those numbers are different, and we are likely going to be closer to about 70%, I would say, probably for our state as we get into this week's report. So, this virus is fast moving, and as you can see from those numbers, it's going to change rapidly.
Okay, Dr. Manisha Juthani, thank you so much for your time and taking our questions. Appreciate it.
Thank you.